In the video today, we're going to chat a little about stenosine tenosynovitis, which is a fancy name for trigger finger. It's a really common hand injury that we see a lot, and it can be annoying and limiting in your daily life, making it really difficult to do the things that you want or need to do. So first, what is it? Let's break down the word tenosynovitis to help us understand. The end of the word, itis, means swelling or inflammation. Teno refers to a tendon, and syno refers to the synovial tissue surrounding the tendons, basically a layer of tissue that wraps around the tendon, kind of like a tube. So tenosynovitis is swelling of the sheath or the layer of tissue that wraps around our tendons. In the anatomy of a normal hand, each finger has tendons that run along the finger. Tendons are what connect our muscles to the bones to create movement. The tendons in the fingers are held down to the bone by these little perpendicular loops, which we call pulleys. As we go to move our fingers down, as if we're making a fist, the muscles in our arm activate and the tendons glide to pull the fingers down. And when we go to release the fist, our tendons are sliding and gliding back to the resting position to help us open the fingers. Now, let's take a look at what would happen if we start to get a buildup of that swollen tissue around the tendon or our nodule. You can see in this sketch, the nodule is located in the index finger. When the fingers bend to make a fist, the tendons glide down normally, no big deal. But when we go to open the fingers again, you can see that that nodule on that index finger is getting stuck on the pulley. It can't glide through. There's just no room for it to go. That's when we get our triggering effect, and the finger gets stuck in a bent position. A lot of people, especially if the nodule's really inflamed, will have to actually use their other hand to help them open the finger back up again, and it tends to be really painful. Okay, now we know what the basic condition looks like. Let's talk about how it happens. There are a few theories on what causes trigger finger, but it's likely attributed to repetitive use of the fingers or the thumb. We just use our hands so much in our daily life. Doctors don't know exactly why some people tend to get trigger fingers and some don't, but it might be related to our diet, our age, our gender, or hormone fluxes within the body that may make some people more prone to inflammation in general. People who have other conditions such as rheumatoid arthritis, gout, or even diabetes might be more prone to developing trigger fingers. It can also be caused by having to exert continual force, such as having to grip heavy equipment over and over. It can be really frustrating diagnosis because we don't know 100% why trigger fingers happen. But repetitive movements that require continual exertion of the fingers or using them over and over, or heavy gripping, things like that, they should be avoided as much as possible if you're experiencing any triggering. All right, so that's a little background information on trigger finger. In the next video, we'll talk about what you can do about it, including a couple of quick stretches you can get started on today. Thanks for watching.